December marks the one-year anniversary of the Next Generation Nursing Assistant Initiative here in Minnesota.
It's a program to combat statewide staffing shortages at long-term care facilities and veterans' homes. I
sat down with Senator Tina Smith earlier today, who worked to get funding for that program, about what's making it so successful. It sounds like this is a great thing that you have going on. Tell us a little bit about how it's been working out.
Well, there is a real shortage of nursing assistants in Minnesota and around the country. These are the individuals that work in assisted living centers or veterans hospitals or other hospitals. And with resources that I helped secure through the American Rescue Plan, the Walz administration has put together this great next generation nursing assistant program that has helped to train over 1,300 people for this great job. Governor Walz just announced an extension of this program, which is great to hear, and I'm really proud to have been helpful in getting the initial round of funding through the American Rescue Plan to help get this kicked off.
So these CNAs, they've already been in homes working, is that correct?
Yeah, so the first, the goal was to train about 1,000 certified nursing assistants in 2022, and that number has been surpassed. They've already trained 1,300, and now there's an opportunity for more people to participate because of extra funding that the state is putting forward, which is really great. These are folks that are doing kind of the backbone of healthcare in assisted living centers where people might have pretty complicated medical needs. In veterans' homes, they're kind of part of the base healthcare team along with doctors and nurses and other providers that help to take care of people when they have complex health conditions or are in some process of healing themselves.
What kind of training are these people going through to ensure that they're qualified to be working in these facilities?
So what's happening is through this certified nursing, this next generation nursing assistant program, folks are getting the certification training. It takes about 2 to 3 weeks, and the program offers people tuition and covers fees and books and uniforms, sort of all of the costs that they might have to get the training that they need. And then that prepares them to be able to go right into a work situation and start taking care of people.
What kind of money are they saving by this legislation? How are they saving money by having this tuition or this training paid for? How much are they saving?
Well, so it's a really interesting question. I can't give you the exact dollar amount. The training is being provided in partnership with the with Minnesota State colleges and universities. But I think it's fair to say that students are saving thousands of dollars, and that makes a big difference. Before this initiative was in place, a lot of people were entering and then dropping out because they just couldn't put together the money. A lot of people are struggling to pay the bills that they have, and then taking on this extra cost of an education and the other things that you need to purchase, like books and uniforms, was just too much for them. It's great to see that the retention has been a lot higher because these basic costs are being covered. And we all benefit because we need folks with this training to be able to take care of our loved ones or us when we have the need.
Senator Smith, thank you so much for taking the time to talk with me and answer some of those questions. I really do appreciate your time. And that program quickly exceeded its original goal of recruiting and training 1,000 new nursing assistants. And to date, it has trained more than 13,000 Minnesotans. Advocates say it's strengthened the state's healthcare workforce pipeline. Because of its success, the program has been extended through February of next year.